Good morning. Let's see if... So, yes, well, go back. I opted for technology. I should have went with the notes, I guess, the handwritten. So, good morning. I'd like to, I think I have it, yes, right? Yeah. Thank you. All right. I'd like to start off by thanking my family for their support in this little European adventure we decided to take, even attending this conference. Particularly, I want to thank my beautiful wife, fellow naturopathic physician, Dr. Christina Romero-Bosch. I am continually in awe of your strength, your intelligence, your wit, your humor in the sort of absurdities of life, and your woman personified, and I love you. Thank you to the President and Secretariat for your grand efforts with this excellent Congress, for allowing me to present. Thank you. The title of this presentation is Naturopathic Solutions for the Global Health Impact of Lowering Testosterone and Sperm in Males in Industrialized Countries. I felt it vital to the discussion to write a paper on the topic. So it's complete with proper citing from the research literature on all the points proposed in this presentation. So you can find that as a free downloadable PDF file on my practice website at www.hormone-zone.com, hormone-zone.com. So I'd like you to come away with some key concepts from this presentation. Firstly, some of the actual evidence that across the globe, both testosterone and sperm are in fact lowering. We will also explore the physiology of testosterone that's relevant to the specifics of what I'm presenting, sort of setting the physiologic backdrop to establish why it's important that there's this global decline. And what the inevitable health consequences are, but even more important, the social sort of reasons and constructs causing the decline, or maybe the decline causing formation of certain social constructs. And what the causative factors are numerous, and finally, of course, the naturopathic and medical interventions. And I have no disclosures for this presentation. So, is testosterone declining in men? We do know that testosterone lowers at an approximate rate of 1% annually for men after the age of 30 across Western industrialized countries. This is a very well-known and established understanding. But is testosterone declining in men globally from a generational standpoint? Yes, we are seeing evidence towards this end. In Finland, evidence suggests that 25 to 29-year-olds have lower testosterone than 70 to 74-year-olds. In Denmark, we see that more biologically active free testosterone is lowering. But a larger observational study done by Travison in the US showed an actual 22% decline in testosterone levels in equivalent cohort males from 1989 to 2004. This is important because it's showing a generational decline in male testosterone. So what about sperm decline? There's more research on this topic in comparison to testosterone levels, but it's also more controversial because of all of the research analysis that's been done, and there's some that's refuting the idea. But for the most part, most experts do believe and conclude that they're seeing this sort of decline of sperm. So, just like testosterone levels, sperm count also has a normal course of decline in aging male. It's about 2% annually. And we see multiple examples of studies, including a decline in sperm counts and fertility rates in age-matched generational cohorts. Denmark showing a decline, right here in the UK. Italy, very high fertility rates in India as well. So most of the research started after a landmark 1992 study by Carlson in the United States, showing a 50% decline in sperm from 1938 to 1999. So this was sort of the big moment. It sparked all this controversy and debate until a recent large study in France in 2013 actually demonstrated yet another decline from 1989 to 2005. So it is worth noting that we have a Spanish study showing normal sperm count and quality, along with a very low incidence for testicular cancer. Many of the men in my wife's family, all the Spanish heritage, they're going to be really happy to hear that, I'm sure. They'll be gloating about it, no doubt, tonight over cocktails. So the effects of testosterone are widespread in the male, affecting all aspects of his being and in an interconnected fashion. I like to emphasize that. The physical effects bring on secondary sexual characteristics, most of course we're all aware of, particularly puberty, but also continue to influence well into adulthood. Anabolic effects such as increased skeletal muscle growth, bone density, androgenic effects of testosterone lead to the development of male secondary sexual characteristics, again, that we know about: maturing the penis, increasing facial and body hair, enhancing the larynx. Testosterone influences the maturation of sperm, of course, and testosterone is extremely important in optimal cardiovascular functioning. Let's see, yeah. So emotional aspects of testosterone include mood stability, quality of life. Mental aspects of testosterone are very well known, including enhancement of cognition, spatial skills, recall. Intriguingly, testosterone is not only produced in the testicles and adrenals that we would classically understand. It's also produced in the brain through a steroidogenic acute regulatory protein, or STAR protein. So indeed, the brain is both influenced and in direct need of testosterone. Finally, testosterone has a massive impact on social and behavioral aspects in the male, with a tremendous amount of research in both humans and mammals. Again, technology here. In the field of behavioral endocrinology, which I think is very intriguing, the eminent Stanford neurobiologist and science writer Robert Sapolsky is a great place to start in an understanding of behavioral aspects of testosterone. I highly encourage looking him up. Testosterone enhances libido, risk-taking behaviors, and overall concepts of self-confidence. Men tend to be more aggressive, but when studied more closely, we actually see that it's really more about assertiveness in situations of status and dominance versus just outright violence. It's also about rule enforcement. Men ensure social order through punishment when the rules are not followed. Indeed, the antiquated concept and simplistic view that testosterone creates aggression and violence in men ipso facto is being regularly challenged, particularly in the past about 5 years in the research. One important idea is that testosterone promotes pro-social behavior, leading towards a tendency of honesty. In a double-blind, placebo-controlled study in 91 men administered physiologic exogenous testosterone or a placebo. Then they were given a task to self-report whether or not they might have been lying on a financial payout. So they were given an opportunity to roll a die and write down what their response was, and with nobody seeing it. And they would actually get a certain amount of money depending on what the result was with the die roll. Now, both groups lied. But the men with higher testosterone levels, they lied less. Okay, so the health consequences of lower testosterone and sperm are vast. Physically, there are many. Most well documented is the lowered bone and muscle, increased risk of cardiovascular disease and diabetes, a particular triad. We also have the direct association of lower testosterone sperm with the testicular dysgenesis syndrome. This includes hypospadias, the abnormal placement of the urethra, cryptorchidism, the condition of a missing testicle, poor semen quality, and testicular cancer. Now, mentally, we see an increased risk of Alzheimer's disease, dementia, even age-related cognitive decline, something we see quite a bit in our practice. Emotionally and psychically, we see an increased risk of depression, anxiety. And finally, we have social and behavioral consequences of lower testosterone. One of the key results of lowered testosterone is decreased sperm count and quality that leads to the infertility. So it's the testosterone leading to lower infertility. Affecting birth rates, perhaps most intriguing, testosterone levels are associated with a tendency towards social structures. Two recent studies found that men with higher testosterone levels tend towards a capitalist social structure and were more self-reliant. Men with lower testosterone levels tend towards a socialist government structure and believed in a collective effort. The most poignant thing they discovered, at least in my opinion, was that they had these beliefs despite economic status. So financially poor men with higher testosterone still believed in self-reliance. Rich men, having benefited financially from a capitalist system but had lower testosterone levels, still believed in group government oversight. So what are some of the reasons why we're seeing the sperm and testosterone lowering? In utero toxicity, exposure by endocrine disruptor chemicals, something I'm sure many of us are all aware of and concerned about. This influences testosterone levels and sperm viability in the male fetus. But less commonly known is the influence of maternal testosterone levels on the testosterone levels of the male fetus. Women with higher testosterone levels, known during the middle of the second trimester of development, influence the male fetus to express higher testosterone levels and sensitivity to testosterone through the androgen receptor. I think this is brilliant. This is revealed in the 2D/4D ratio. In both men and women, the ratio of the length of the second digit in comparison to the length of the fourth digit is predictive of testosterone levels and predictive of a multitude of other physical and psychological parameters, something that's been studied since the late 1800s. We can see that the hormonal status of the mother, particularly her testosterone, has a lot to do with the testosterone physiology in the male offspring. So other causative factors for lowering testosterone in sperm include comorbid disease associations, the classic triad of diabetes, cardiovascular disease, obesity, are both causal and resultant of lower testosterone levels. We even see an association with thyroid disease. So lifestyle and environmental factors are extremely important because we can change these things. Nutritionally, lack of protein and high-quality fats, including saturated fats, will lower testosterone levels. Recreational drug use, including marijuana, may lower testosterone and increase estrogens in men. That's controversial. Interestingly, alcohol, when consumed moderately, actually increases testosterone levels, but when excessive, it will lower testosterone levels eventually. Multiple prescription medications have been shown to lower testosterone. Also, a sedentary lifestyle decreases testosterone and sperm. There's mounting evidence that endocrine disruptor chemicals actually are affecting genetic systems, demonstrating one generation getting weaker than the other. And men are having less sex, perhaps as both cause and result of lowering testosterone. A recent study published in the Archives of Sexual Behavior found that American adults, at least, had sex about 9 fewer times in the early 2010s compared to the late 1990s. They offered 2 possible reasons for the decline. One, there's an increasing number of individuals without a steady marital partner. And 2, a decline in sexual frequency among those with partners. And ultimately, men need to be challenged. It is the act of placing men in an environment that challenges their abilities and their ability to take care of themselves, helps to enhance their testosterone and their position within society. Testosterone rises when we ask it to. We give reason to it. Testosterone acts, as all hormones act, as a permissive effect. This means that hormones potentiate a given reaction and even a given behavior. They're potentiating it. There's often a need for some other stimulus. So it's never as simple as saying that a singular hormone affects a biological system in a singular fashion. I think as naturopaths we would inherently understand this. So even though this entire presentation is a focus on testosterone and its causes and effects, we must understand that it operates within a context holistically. Testosterone does not operate in a vacuum. So, Let's move on to treatment options. If in fact we're seeing a decline in testosterone and sperm, and it has all these related issues, then naturopathic doctors, integrative physicians are capable of helping. We will discuss hormone replacement therapy, lifestyle and environmental modifications, naturopathic tools, and social and behavioral choices. All of these can help increase and potentiate testosterone and sperm and treat the related conditions. So, now diet, this is one of the major contributors to testosterone levels and sperm health. In general, adequate calories are needed, but more specifically, higher amounts of protein and fats, including saturated fats, are needed to support optimal testosterone levels in sperm. The treatment prescription for increasing testosterone in men may be quite antithetical to the testosterone and sperm lowering trend of veganism. To consider the work of Weston A. Price, who revealed the eating habits of indigenous peoples all over the world, that their health and fertility was maintained and actually flourished on a diet of high animal fat, moderate protein, and fermented vegetables and grains. This is known as an ancestral diet. Now, exercise in general increases testosterone and improves sperm parameters. We know this. However, high-intensity, short-duration bursting exercise, such as sprinting or heavy weightlifting, increases testosterone more than low-intensity, long-duration exercise, such as distance running. Now, light therapy, this is very interesting. The use of low-level laser at approximately 670 nanometers has been shown to increase both testosterone and sperm. In fact, testicular laser therapy has been studied for also over 100 years with consistent results. And simple sun exposure is also helpful. I saw a great poster presentation that might relate to that concept. A foundational mainstay of naturopathy is, of course, the therapeutic use of water, the Wasser cure. Evidence suggests that cold water therapy stimulates testosterone and sperm production. Limiting toxins, of course, such as exposure to plastics, eating organic and lower testosterone, lower pesticide load, and using personal hygiene products that, of course, are toxin limited. We can't always avoid all of it, but at least toxin limited, are all easy places to start for most men. So there's many classical botanicals that are used for male enhancement. However, very few actually show testosterone enhancing effects. So Tribulus, this is often touted as a testosterone booster. And there's some evidence for this. But most of the evidence seems to point towards its action as an aphrodisiac. So this is true, and it does definitely help with that. And there's ample evidence that Tribulus will increase sperm count and motility. And the dose is around 250 to 750 milligrams in a concentrated formula. Now, Uricomia longifolia is a different story. It's one of my favorite herbs. There's more evidence for this botanical at increasing both total and free testosterone. Now, Uricoma, this is an Indonesian root herb. It's like a very large bush with a very large root. It's been classically used for centuries as a male enhancement tea. To achieve optimal clinical results, be sure that you use an extract of at least 1 to 100, but really optimally 1 to 200. Anything less simply does not have the same effects. Doses are variant. This can be a very, very stimulating herb for some men, and doses are up to 2,000 milligrams. These are safe. Just start low and move your way up. This is a fun slide. Now, ejaculation frequency. This is one strategy of maintaining and boosting testosterone, something that's well known in traditional Chinese medicine, the practice of preserving the jing, or the kidney essence. One easy prescription is to encourage limiting ejaculation frequency based on the formula of age divided by 5. So your age divided by 5 is how frequent within a given week you should ejaculate. One other interesting and anecdotally effective Taoist practice is using injaculation to enhance vitality. Now, this is the process of pressing on the perineum at the Zhenmo, otherwise known as conception vessel 1, and that's right at the moment of orgasm and ejaculation, preserving the energy, the nutrients of the semen, and it's actually reabsorbed through the blood. It also intensifies orgasm and improves prostatic health. Everybody's wheels are turning now at this point. Everyone's doing calculations. So please report back to me. I want to know this for science sake. So look, men need to be challenged. Not only does this increase testosterone and its response, but it provides a reasonable outlet for men, and it potentially translates into psychological benefit. Western culture perhaps is not providing enough of true challenge, where there are clear winners and losers in competition. As an example, we know that testosterone levels will actually respond to winning in a competitive situation. This is called implicit power motivation. Even the perception of winning, the belief in yourself, the belief in your status, your self-worth, increases testosterone. And finally, male initiatory rights, something that is found in many indigenous cultures, channels maleness and provides a backdrop to increase testosterone in a healthy and productive way. In Western cultures, who is responsible for these initiations of men? I would argue it is the testosterone male that is charged with this responsibility. If we now understand that the testosterone male is made by the testosterone woman in the womb, then it should be understood that it's the testosterone male who helps to mold him. One other interesting and anecdotally effective, oh, no, I already said that. Finally, we come to testosterone replacement therapy. Now, a bioidentical hormone implies a biochemical structure that is identical to the endogenous hormone. It inherently has less potential for side effects, less. There are multiple routes for bioidenticals, all with their own unique pharmacodynamics and clinical results. Now, oral routes, transdermal creams, gels, even patches, all tend to have a varying absorption rate, delivering variant hormone levels, and certainly variant clinical results. This is not always the case, but generally it is what I see after 11 years of doing this. The pharmacodynamics has been studied, and they demonstrate this sort of up and down, peak and trough kind of process. Now, at our practice, we focus and have excellent results with subcutaneous injections of testosterone and subcutaneous pellets. Now, in respect to subcutaneous injections, we use testosterone esters such as testosterone cypionate, and we administer small doses more frequently, typically twice weekly, into the subcutaneous fat of the abdomen versus the intramuscular shots that they tend to do. So the fat actually acts as a depot, and it releases the testosterone more steadily. This leads to more consistent results and enhanced clinical outcomes, of course. Now, subcutaneous pellets, they've been used in Europe since 1937. They've been used continuously in the US at the University of Georgia Medical School since 1939. There's nothing new about it. I am proud to say that I worked and studied for years with a pioneer in this field, the late Dr. Gino Tutera. Hormone pellets are placed subcutaneously in a simple minor surgery procedure. And through a slow and steady dissolution rate, the hormone is delivered 24/7, nonstop. When appropriate, this is one of the most effective ways to deliver hormone, keeping levels consistent for up to even 6 months. The other advantage, of course, is that they are nothing but crystalline testosterone, and their chemical structure has not been altered in any way. They are completely bioidentical. So, in summary, we can now see the larger picture of the optimal testosterone male. We can specifically see what constitutes the male. He possesses optimal muscle and bone with a lowered risk for osteoporosis. His cardiovascular function is excellent. His overall metabolism is maximized. He's sexually active. His libido is intact. He's fertile. He's lean. His cells are highly responsive to testosterone through the androgen receptor. He is emotionally stable. He possesses a motivation and drive to succeed. He cares. So, How? The testosterone male is created and maintained due to several things. He stimulates his neuroendocrine system with lifting heavy things. Through strong physical work, he's active. He benefits from a limited toxin exposure to his environment. His alcohol intake is moderated and tempered. From a clinical standpoint, he is functional and optimal with testosterone levels above 600 nanograms per deciliter. You guys will have to, if in the UK and all, you'll have to divide by 28.8 to get what would typically, I believe it's nanomolars. He's sexually active, he's sexually conscious, he's in control of his sexual prowess. He eats as his ancestors ate. The focus is on high-quality, toxin-free animal protein and fats. He is the vegetarian who eats meat. His mother provides the safe and toxin-free environment for him in utero. Yes, indeed, the testosterone men are created by the testosterone woman. So, finally, who is the testosterone male? The testosterone male is the fully integrated man, balanced physically, mentally, emotionally. He is confident and calm, but he is of action and will assert his position. He is sexually conscious and seeks to establish a family. He is a risk taker. He, in fact, and despite any conventional misconceptions, is overall pro-social. He is self-reliant, and I would say most of all, he is free. Ladies and gentlemen, colleagues, testosterone sperm in men are lowering. This is a widespread global issue with widespread global effects on men physically, mentally, emotionally, culturally. This presentation today is the clarion call of action for all men and the women who love men and need them. I believe that naturopathic doctors and other functional medicine practitioners play a pivotal role in helping men. It will require a comprehensive approach to increase the consciousness of the testosterone male and the very consciousness of the society in which he resides. And I think we have one more. So, on a personal note and in closing, my father, James Albert Robinson, he would be in his 80s were he still with us. He was an Englishman, through and through. A Londoner he was. He lived through the London bombings of World War II as a child. He was tough. He was proper. He taught me the same. I came here to London as a child a couple of times with my father. He was deeply, profoundly proud of his heritage and of what little I really knew of him. That was the only thing that I was really the most sure about, his love of God and country. And it makes me tremendously proud to stand here on the old sod, as it were. Perhaps for him, perhaps me. Perhaps for the idea that manhood in all its boldness is important and necessary. Looking out at all of you, being here at this conference with friends, I'm truly hopeful. I'm filled with pride. With our combined efforts, perhaps now, the fully integrated male will rise to the call of our times. I will leave you all with this. The world needs fully integrated men. God save England. God save the Queen. Thank you.